Awesome. Thank you. All right. Thank you everyone for hopping on. We're going to go ahead and get started, and we are recording. Let me go ahead and share my slides. And also I have the auto attendance tracker on, but if anyone has called in, let me know so I can type your name into the chat so we can capture that for attendance. So is anyone just on the phone? All right. Okay. Okay. Thanks for hopping on. So we have a lot of pick list stuff to go over. And so this is pick list for the ESO patient registry. So for those of you who are still using the desktop trauma one, this is not as applicable for you, but just that clarification. So the first thing I wanted to point out is Tempe St. Luke's is now Honor Health Tempe Medical Center. Did we have a hand? Okay. And so for those of you who are your own admin, you can go into your hospital list and make that change. And I would suggest doing like we've done in the past and putting that it's Honor Health Tempe Medical Center and then in parentheses Tempe St. Luke's as of 2025, just so you have that reference. And then for those of you who are level 4s and I'm your admin, I will make that change to the hospital so that you have that update. The next thing I wanted to talk about is make sure you have, I've already updated this for the level 4s, but for those of you who are level 1s or 3s, or I'm not your admin as a level 4, the drug use indicator and the alcohol indicator, not suspected, was missing on some of those, and that's what you'll select if it's not tested. And so make sure that that not suspected list or pick list option is there. Also, the emergency department transfer delay reason field used to be a single select field, and it's now been updated to be a multi-select. This is more applicable for the level 4s, but you can now choose more than one of those options, and that is appropriate. So let me know if for whatever reason it's still showing as a single select. It shouldn't be. It should be multiple select. And then protective devices. I'm still getting some clarification from ESO on this, but I wanted to bring it up because you're probably seeing in the past we only had like helmet as an option, but now there's ski helmet, motorcycle helmet, and a ton of other options. So right now they're mapped to, so all of those helmet options are still mapped to helmet, but I was doing some report running with a facility and you can still pick the individual helmet options. So I'm just checking to see if we need to turn off those extras or what we need to do. Same with airbag details. So I just wanted to bring that to your attention that they are mapping correctly. It's just with report running, you have those different options. So that can affect your numbers if you include just helmets, but there's also the ski and the motorcycle and all of those options. So I'm working on getting more info and I'll follow up with you on that. So if we need to change the pick list, we can do that. Or if it's mapping properly and we don't need to worry about that, I'll let you know. The next thing is if you remember, there's a button that says save and add new payer when you go to add your primary payer, and that didn't work. It does now work. So you can go in, add your primary payer, and do save and add new payer, and then it automatically brings that up instead of closing it out and then adding to another one. So it just saves you a little bit of time. So that button works. So let me know if it's not working for you for some reason, but it should be. Any questions on this slide? Okay. I wanted to go over this because there seems to be a lot of confusion on the different disposition fields. So first of all, if your discharge disposition pick list looks weird and you have a lot of odd options, I've already updated the level 4s, but for you level 1s and level 3s, there shouldn't be any other options other than the state options. So I can send out the data dictionary just so you have that as well. But there's 3 different disposition fields that I'm going to go over. But your first one is the emergency department disposition. So that's are they going to the floor, the ICU, or they transferred out, that long list of options. And then it's kind of confusing because they have the state ED disposition type. when in reality, that's not really what it is. If you remember, it used to be on the first page of Trauma 1, and it's that admission status at reporting facility. And it's just like 4 or 5 options. So I've seen some people leave this top one blank thinking you only need the state ED disposition type, but both of those are required and they are different fields. We thought for a bit that they were just duplicate fields and they're like an extra ESO field. It's not, it's just named weird. And so those are both required and different fields. Does that make sense? Any questions on that? Okay. And then the third disposition is when it's the inpatient, the timeline option. When they're admitted, then you can have the discharge disposition. Hey, turn my light on, please. Other one. 4-year-olds, love them. Close the door, please. So you have to leave that as NA if your patient left the ED. So if they're not admitted, you don't need to fill that out. I think some people thought they were just going through and filling out everything, which we're learning, and that's totally fine. But you won't need that discharge disposition filled out. It should be NA if your patient is not admitted. And I was going through and looking at some reports, and there were some that said transferred out and then they had a home with services on the disposition. So I looked into it, and the flag that didn't allow that had accidentally been turned off on ESO's side. So I reached out to them and they're turning the validation flag back on. So just make sure that you're not having that if your patient wasn't admitted. Any questions on that? Okay. Okay, as you all know, the state repository is not quite ready. And so we're waiting. The estimated date is the beginning of August. So once we get more information on that, I'll make sure and reach out to everyone so that you know we're getting close to being able to submit data. So we've gone over this a couple of times, but I wanted again to show you guys so you're familiar, because it's a new process of when that's ready, how you will submit data to the state. So I'm going to change my screens. Okay. So this is the screen. It should say it'll probably say your hospital. I can't see your guys's, but this is the state trauma repository. It may say your hospital trauma repository. Jody went over this if it looks familiar, and we also went over it at the training. But it's pretty straightforward. So what the process is you're going to export a file, and all you'll have access to is your hospital files, and then you'll upload it into the repository for the state, and that's the part we're waiting on. So you're just going to click your hospital. You're only going to see yours though. You won't have access to everyone else's, so it'll be pretty straightforward. Okay. No organizations found. That's okay. Let's go back. Maybe I have to pretend to be someone else. Okay, so you're submitting to us. It's just going to give you the option of trauma. Let's say, make sure, so it is broken down full versus reduced. So make sure you're selecting the right one. So I'm going to say reduced, and then make sure it's level or the correct year and the correct quarter. It says closed, but you can ignore that. I think that's because it's past the due date, but it should be open. All right. And then this is where you'll submit the files. So you can save your file wherever you saved it on your computer, and then don't change the name, nothing like that. And then you're going to upload it. So this is where you're going to upload it. And then I'm going to cancel that because I don't have any real data to submit. You'll see your name here. This is because a lot of you have tried and it's not your fault. It's just the repository is not ready yet, and that's why it's not working. But once it is approved, it will say accepted. And if there are any flags or anything, it says rejected here, you can download the file and the report. And it's very similar to the Trauma One validation, where it shows you the record number and then what's the issue with the flag. So those flags will need to be fixed before the data can be submitted. Okay, let's go back here. So most of you have submitted data already, and I say submitted data. No one has submitted data yet, but we've asked that you send in your data submission forms and a screenshot of your registry volume showing us that your data is at least in there and ready. And so if you haven't done that yet and your data is ready, please send that to me so that we know your data is in the registry. Most of you have done that though. Then the last thing, I sent out an email last week, but if you'll remember back in May, ESO changed from the 2024 template and they released the 2025 template. And so we had you go in and turn that template on, and ESO had said that any 2024 records that were locked were going to be fine with validation. They've since told me that that's not the case and that you will need to go in and make sure each record shows that 2025 AZ full, AZ reduced, depending on which center you are in, or else it will not validate. So if anyone has any questions on that, I was working with them to try to figure out how to build a report to pull which ones had 2024 versus 2025, but they have not succeeded in that yet. So if I figure that out, I will let you know. So yes, any questions on this slide? Beth.
Yeah, so every single hospital in the state of Arizona, from my understanding, has to open up every single chart from January 1st, 2025 to when it was turned on in May. In the old Trauma One, whenever we didn't get the validation for several months for the new year, they had a workaround in the background where they could go and do that. So is ESO saying there is no workaround where they can go in and do this for us in the background, or we're going to have to spend all that time? Because it's not just, I mean, you have to unlock the chart, you have to change it, you have to revalidate, and because there's 2025 validation now, we're going to get errors on those 2024 charts, you know, and then fix those and revalidate and before we can lock again. And that is like a huge undertaking. And it seems like ESO should really step up to the plate and try to find a workaround for this, because this is crazy. I'm sorry, but it's just nuts.
Yep. No, I fully understand, and I have expressed my I was very upset when they told me. I said, do you realize how much extra work this is going to cause for them? And they said that there is no workaround, that they've explored their options, and that is the only way for it to work. So unfortunately, that's what we're going to have to do. They've said that there shouldn't be extra validations or things you need to fix, but you have to change each record to that 2025 and close it, or else it won't pass the validation. So unfortunately, there's really nothing else to do at this point.
Okay, but there are extra errors. We've tried it, and some new ones do pop up.
Okay.
So then you have to go into Cerner and open up the chart and figure out, you know, and answer those questions. So hopefully not on every single one of them, but yes, there are some ones that are popping up that did not pop up when we validated them and closed them originally.
Yeah, no, and I understand.
This is Melissa from Tucson. Just question, is it worth an escalation? Maybe having Kim get on the phone, scheduling a time with ESO? Because by the chats, it looks like it's a boatload of work.
No, yeah, and there's not really any escalation, and honestly, we're waiting on so many other things for them to do that have been escalated. And we've asked multiple times, is there any workaround to this? And they've said no. And there's not really much else that we can do at this point. And as far as escalations legally, the deliverables and contracts there's nothing that says they can't have this, this 2024 to 2025, right? There's not a specific deliverable to hold them to other than they have a validator that works, but nowhere does it say they're not going to have us go back and fix charts from a different year to a different year, if that makes sense. But I think it's a good going forward when they're making changes and telling us that we don't have to do something when we do, and it's going to cause a lot of work, to make sure that that's going to be true going forward, so this doesn't happen again. So yes, I know it's a lot of extra work, but unfortunately there's not anything else for us to do at this point. I don't know. I'm not able to see the messages. I hear the sounds, but I'm not seeing them.
Do you want me to read them out?
Yeah, and it's all I'm seeing are the attachments. It's not letting me, or if you can just screenshot them and save them. I'm not seeing them for some reason.
The most recent one is I think the message here is the state cannot expect a submission as soon as the repository is ready.
I mean, the repository won't be ready for a couple of weeks. And I did let everyone know last week about this. And I recognize it's a lot of extra time. So if you're going through, keep me posted, but we'll keep you posted as far as the repository goes. But you do have at least 3 weeks to be working on that.
I can tell you I've done 2/3 of our charts and it's made me change every single chart.
What changes have had to be made? Like, is there a specific?
You have to go in and anything that they added to the 2025 submission, you have to go in and change. If you don't, you're going to get a validation error.
Do you have an example of, I guess you can email me that, but I'm just trying to figure out what changes, because they're,
I mean, I'm only a level 4, so I know my changes are a lot less than the other ones. But
Yeah.
I know that even as a level 4, there's been requirements in every single chart. I've had to go in and check at least 3 different areas.
Yeah. Nicole, go ahead. You're muted if you're talking.
Can you hear me?
Yes.
Okay, so I just opened a chart from January and it has the 2024 Arizona full data set. But we turned it off a while ago, but when I tried to like edit it to get a 2025, it's not even an option to pick.
Okay. And you turned it off a while ago, so you have the 2025 listed for your template.
Correct.
Okay. Can you submit a ticket and include me on that? Because we saw it for one other facility when we were working on this and they, okay.
I mean, this is back from like January 1st. So it's when we had the 2024 on.
Yeah.
But when I just tried to edit it to like make it to 2025, it doesn't give me that option. But I do have a 2025 for TQIP, but not for Arizona data.
Okay. Let's see.
So
Okay.
I have a workaround. I had seen that too. So if you click onto a different page and then click back in, see if it pops up then.
Did that work, Nicole?
It did take Flagstaff several tries to get that 2025 to pop up. And then, Carissa, some of the people that were answering, typing when they have to go in and revalidate, because of the pre-existing that they've added, the rules on the middle initial, some of the EMS or time of injury, those were some of the things that were popping up that now that it's 2025, you have to go back in, you're getting errors on that. So like I said, it's not just an easy quick of going in, changing it, taking off the 2024 and putting in the 2025. It's way more time consuming than that. And I know we don't have a choice, but I'm going to say this and probably get strangled for it, but ESO's been nothing but trouble ever since we got this new program, and I really wish the state would have picked a different program to go with.
Yeah, I know that there's definitely been a lot of hiccups and it's not been super smooth. Unfortunately, that's the one we have, and I think any registry you change to is going to have issues, but I do agree it's been rough. But we'll have to work with what we have until that's not it, and if they continue to not provide contractually, we'll see what happens. But I do understand that it's been a hassle for you guys, and that's been my feedback as well to my leadership and to ESO. So just know that you are heard, even if it feels like we can't do anything about it. But I am just as frustrated as you. Okay. I still can't read the chat. So instead of putting things in chat, I don't know why it's not working, but raise your hand if you have anything, because the chat's not working for me. But it looks like Shelly can still see it. So we will screenshot it and I'll look at it at the end, but I can't see it right now. So any other hand raises for this? Okay. Got it. Other than we're going to be forming a riot off the record. Okay. So next data submission is due October 1st. Again, this is a weird situation. We'll keep everyone updated. It will be working by then, or else it'll be bad. Expect email reminders. This is all very much the same, as you know. One thing that was pointed out to us, do I have a hand up? Okay, so I did see that chat. Okay, thank you, Heather. Is a hospital noticed that there were some issues with time zones on air transport agencies. And so, but it wasn't just like, it wasn't an odd number. It wasn't like 27 minutes. It was off by 1 or 2 hours. And so if you're seeing that on any of your run sheets with air transport agencies, let us know, and I can reach out to Ann, our EMS manager, and she can fix that on her end, because all of the EMS agencies have different vendors for the most part, and sometimes things get mixed up and they have the wrong time zone. So if you notice that, let us know. Is that a hand? Beth, go ahead.
I'm taking up a lot. So just FYI on EMS, also, because if you're getting patients in from the Navajo Nation reservation, they do daylight savings time. So you could have times off from that. And what we found too is in one of the agencies down in Cottonwood, they use an outside vendor, I guess, for their EMS records, which is out of state, and they're putting the out of state times on there. So you really do have to kind of look at that and adjust it to look at the time that they arrived in your hospital and go, okay, this is an hour off because they came from Navajo Nation, or some of these flight companies come out of Colorado, New Mexico, when they're on the border. So that's why you're getting time differences also.
Yes. So for instances like that, where you know the Navajo Nation is on a different time zone, then that makes sense. But if you can't, if it doesn't make sense, like in one of those situations, then reach out to us and we can work through that. Okay, another thing I wanted to point out is, so direct admits, you do not need to add an ED timeline page, like at all. So if you have it marked on your arrival information timeline and marked as yes, just don't add an ED timeline page. So just a note. I also had some questions on mechanism of injury, and I think it's good to go over this every so often for new people. So these are just some different definitions. So blunt is resulting from impact with a dull object or surface, causing internal injuries without breaking the skin. Car accidents, falls. Most of your traumas, I'd say 90% are going to be blunt trauma. Penetrating is caused by sharp objects piercing the body, leading to external wounds and internal organ damage. So I usually say if it's a gunshot wound or a stabbing, it's probably going to be penetrating, but that's also if someone runs into a fence post, it goes through their leg or something like that, that's also penetrating. But for things like dog bites or things that you're questioning, sometimes it's going to be blunt versus penetrating. Penetrating is more internal damage and usually just gunshot wounds and stabs. Burns are pretty easy. It's resulting from the exposure to extreme heat, chemicals, causing skin and tissue damage. So and I'll share these slides. So if any of you want to keep those on hand, you can. So there was also some questions on the toxicology fields. Is that a hand? Yeah, Shauna.
Hey, Krista, back to those different penetrating and blunt. Is it still correct that you would, for example, we just had this the other day where we had a car accident. So that was like the main mechanism, but then part of the car, like door or something, punctured somebody's leg.
Mm-hmm.
So would you choose blunt because that was the initial mechanism, or do you do penetrating?
That's hard because there's not two spaces to put a follow-up. I would say whichever injury is more severe. I don't know. There's not really a definition for that, but I think a car penetrating the leg is probably going to be more of a severe injury. So I would put penetrating if that's the majority of their injuries.
Okay.
Would be my input on that. But,
okay.
Yeah.
Thanks.
I don't think either would be wrong, really, but I think that would be what I would lean towards.
Okay. And I think I had been doing it where whatever like happened first, or like the first cause or the main cause is, I think, what I had maybe been taught or thought at one point, but I kind of like your way of like whatever's causing the biggest problem or the most injury.
And most of the time when we code things, it is in the order of what happens. So that is logical. But I feel like if they had a really bad leg injury in this situation and they were admitted and had all these surgeries, but they were just a car accident, I feel like the penetrating would show, okay, something more happened here, would be my logic there.
Okay. Very good. Thank you.
Yes. So there were some questions here. So the alcohol screen is just asking whether or not the blood alcohol test was performed. And then the alcohol use indicator confirmation is the same as it was in Trauma 1. Blood alcohol levels are recorded in the Add Labs entry tab. And then the same for the drug use. The drug use indicator confirmation is the same as Trauma 1. And then the drug use is the list of drugs that they tested positive for. Okay, trauma activations. I've had quite a few questions on this as well. So you need to add in.
I'm sorry. I'm so sorry.
Go
There's
ahead,
one in the chat. Ashley with John C. Lincoln said she had a patient who was hit by a boat while swimming and got cut up by a propeller. Is that blunt or penetrating?
Cut up by a propeller. Cuts. Let me think about it. Yeah, I would say blunt. Okay, this consensus is blunt. We're gonna go with that. Without reading it, like, unless it's, I would say if like the propel, I don't know. I would have to read it, but I would say my initial gut reaction would be blunt. Autumn. Yes, go ahead. You're muted if you're talking.
Sorry.
You're
Sorry about that. I just wanted to add, for cases that are both blunt and penetrating components, my understanding, excuse me, is you are supposed to pick on the greatest impact on the probability of survival. Sorry, excuse me, not the trauma type generally associated with the mechanism of injury. So I feel like, you know, what you're saying in regards to the trauma type with the most impact, that would be fair, like to, you know, to note on that. Like an example that I have is like a skier falls, breaks a leg, and then it's impaled in the heart by a tree branch. The injury most likely to impact the probability of survival is the impalement, so the penetrating. So that would trump the blunt. So I just wanted to add that.
Okay. Yeah, no, thank you for adding that. So I wasn't too far off. Okay. Shelley, go ahead.
The follow-up is a request to the data dictionary. I give an example or be more specific for trauma type?
For trauma type. So would adding those definitions into the data dictionary be helpful? And then maybe also adding in this little sidebar on if there's multiple. Okay. I'm trying to, again, so I'll add in the definitions that I shared, and then also if there's multiple, so if there's the example we gave with the skier or anything like that, where it's the thing that's going to have the most effect on the patient's survival will be what you're going to go with, because there's not an option to pick two. Okay, that sounds good. Any other questions, Shelly, that I'm not seeing?
I think we got the bulk of it there.
Okay.
Anyone, please speak up if I am mistaken.
Okay, yeah, Danelle, the dog bites are penetrating. That's what I've always gone with. I see them as they pop up, but then once they go away, I don't see them anymore. So, okay, any other mechanism of injury questions? Okay. All right, so make sure you're adding the 991 complete tribal trauma team arrival for that team member type for any of your activations. And that is, and if you are at a level 1 and your full trauma activation includes radiology, all these people, whenever that last person's there and that's your complete trauma team, that's the time you're looking for. If you're at a level 4 and you only need the ED doc and the trauma nurse, that's your team, and then that would be the time that you're recording for that. And also, I know that you can add in your individual doc times and stuff like that for ACS, but that needs to be added in so we have that time for the state.
Looks like the chat was clarifying the dog bites.
Oh, yes. Yep, blunt. Dog bites are blunt. All right. So a little bit of good news. So there was some clarification that for POV arrivals, you don't need to go in and enter NA for all of your pre-hospital vitals or run sheet fields. You don't need a pre-hospital timeline at all for those. So if you click that patient arrives POV, you don't need to add the pre-hospital timeline, and it will automatically route that to those being NA. So that's good news. Same thing for the alcohol screen. If you answer no to your alcohol screening questions, the NA will be sent for the blood alcohol level. Also for trauma activations, if you answer no to trauma activations, NAs will be sent. So you don't need to enter the 99 and the NAs on that. So thank you to Danelle for asking ESO about that and clarifying. All right. So updated ASTR data dictionary. So I know I talked about this last time and there have been a lot of questions. The reason I haven't done it yet is there's a lot of moving parts. And so I can't just go in and change the names of things, because we also have, when you guys submit data to the state, those names like from Trauma 1 will be the same and it's mapped to that. So we have to maintain the historical data of Trauma 1 and the names, as well as keeping the space if any hospitals choose to use a third-party vendor. And then also trying to figure out their compliance matrix and things like that. So I'm trying to tie in up all of the sources of like their compliance matrix and figure out how to keep the different kind of names for some of the data elements. And so I'm working with that with my team. And so I will hopefully have it out. I won't say I'm going to wait until we get data submitted, because ESO can say that the data will look this way when I get it in the repository, but I really want to see it before I go making changes to the data dictionary. So I know there's a lot of questions on that, and I will get it as soon as possible, but I know it needs to be updated so it can be more helpful to reflect the ESO patient registry. But that's kind of some of the moving parts to that. So any questions? Okay. Sounds good. And I think what I'll do is I'll make like a sample page or two of how a specific data element is captured, and then I'll share it with you guys, and then you guys can give me feedback, because I think you guys use it just as much as I do, so I think that will be helpful. All righty. Report running. So I'm going to go over, I had a lot of questions on how to build a report. So I'm going to do that. So let me share, let me log out real quick. Okay. All right, so I'm just going to build a report. And we're going to look at PEDS seatbelt use. If I can spell. Okay. Actually, and some of you may be trying to follow along, so I'm going to go over one more thing really quick. This will save. But if you see up here, it says current license designer. So if you're looking and you see it and it only says viewer, if you go over here to this wrench, so there's different types of licenses. And so mine says designer, but if I was Jessica, I would need to change mine first to viewer and then change it to designer. So some of you, depending on how big your center is, will have a different number of licenses, and they can be moved around. So if someone's using it one day, you can then change it the next day. You can buy more, but that's not necessary. You can just switch them around literally 1 minute to the next. So if you're not able to see the dashboard to build it, it's because you need to have a designer license. And I've had instances where a site will say they have a designer license available, but you're not able to give it to someone or assign someone. Reach out to me, submit a ticket to ESO because they've had to go in on the back end to fix it because it's not allowing them to assign their license. So then what else did I want to make sure? Oh, another thing is make sure you're making copies of reports, especially ones that you're sharing. I've worked with a lot of sites, and so what we'll do is build kind of what they like, and then you can copy it and use it for different reports, depending on what you're looking for. So feel free to make copies. And if you're playing around and you like it, but you're kind of changing something, you're not sure how it's going to work, always make a copy. You can always delete reports if you have extras, but that's my advice for that. Also, right here, you can always rename a report. You can duplicate it from here or delete it. All right, so let's add a title. All right. So for those of you who are at the in-person training, I am not Remley, and she is very good at this, and I am still learning. But if you have any questions, I've reached out to her twice, and she's been able to build reports that I haven't been able to figure out, and she's shared them with everyone. So if there's something we can't figure out, they can build it for us. Okay, so we want PEDS. So I'm going to go ahead and go here and type in age. And this is a fake registry. This isn't a real registry. So unfortunately, there's no PEDS charts. So I'm going to pretend like this says 15 and this one. So in a real registry, you're going to see a lot more numbers for your real charts. Or you can just go here and you can type in smaller. So you're going to want smaller than 15 or whatever you're using for your PEDS definition. But because this is fake, I am going to just do that and pretend like those are PEDS. Okay. And then let's see. Let's do mechanism. So if we're looking at seatbelt use, let's do mechanism. Okay, so I'm going to leave. I'm going to say I just want to look at MVT occupant. Okay, so I have, and I want to change this to the last 180 days. This right here is just, the system has the ability to pull deleted charts. So this is saying I don't want to look at deleted charts, but for whatever reason you're doing an audit or you're trying to find a chart that you think got deleted, you can turn that to true, and that'll pull your deleted charts. Okay, so now I want to look at seatbelt use. So let's do, and I think the hardest part of this report running software is the names sometimes don't make sense. And so you kind of have to play around to see, because they have a lot of extra fields you can use for reports that aren't just your name, the name of the field. You have to make sure you're choosing the right one. And then I'm going to do, I'm going to make sure I have those in the right place before I, okay. And then you can either leave it like this and see that 33% had lab belt, this, that, or you can just filter and turn off. If I'm only looking at seat belts, I don't need to look at this. So it's only showing, but so it shows your number of charts. So you only have one that had this and one that had that. And so, but you also can go down here. Oh, I don't want to change it though. We'll apply this. Should pop up. Where'd it go? There it is. Okay. And then I'm going to add a table to look at what records are meeting that criteria to make sure if I can spell. Okay. So this patient then would have had this and this selected because it's only showing 1 and 1. So, but if you're wanting to look at overall seatbelt use, then that, let's see, what would make that more helpful? We left none on. Okay, maybe a bad example because there's 2 of those, but you get the gist. You can filter out different things and build populations over on this side. You also, if you, let me show you a report that I did. Oh, it's in a live system, so I won't show it to you, but let me show you here. Let me share my screen. Sorry, a little scattered. All right. Share. Okay. Okay, can you see the screenshot? It says level 4 state visit log.
It's really small, but we can see.
Yes.
Okay.
Yeah, it's small, real small.
Is that better?
Good.
Yeah, that's much better.
Okay, so I am going to share this report with the level 4s. So if you're level 4, usually Kim will send you that the little spreadsheet that asks for all of these different things. So I've built the report in Trauma 1. But what I wanted to show is you can have filters on the main, because if the way the report running system is it's kind of more of a dashboard, and you can have several reports within the dashboard, and you can have a set of filters for the whole dashboard. So if you only want to look at falls, you can do that. But within each of your little, they call it widgets or reports, you can divide it up. So with this report, I did the ages individually for the adult versus the peds chart. So, but be careful with doing filters for individual reports within the dashboard, because then it can get a little convoluted. But I will share this with all the level 4s who are interested. This has the info that Kim needs. The only thing is we mentioned making the PI list updates. So I can go in and add your different, update your PI list so that you can capture the different categories for the charts as well. But I wanted, the point of that was showing that you can have filters in the dashboard for individual reports. All right. Stop sharing, Jen. Yes, Jennifer.
Hey, thanks for taking my question. So the NTDB defines, to go back to dog bites real quick, as penetrating. Just kind of curious if you can, if we're going against what NTDB suggested, or.
Is that in the data dictionary?
So yeah, I screenshot, I just emailed it to you.
Okay.
Their proposed external cause of injury matrix. So they've got the formatted and unformatted ICD-10 to go along with it.
Interesting, because they also have bitten by rat, squirrel, mouse, any type of. All right, I'll talk to my team, just because I feel like everything I've heard other than that has been that dog bites are usually considered blunt. So, but thank you for sharing. Usually we try to keep in line with NTDB. So I will get feedback from the state to see if we want to either align with NTDB or if we want to have our own definition on that. But I'm not going to make a solid answer on that. But thank you for sharing. That's good to know.
Okay.
All right. Were there any other questions? Can you please explain? Can you read that to me? Sorry, it went away, Shelley.
Can you please explain again when to use confirmed by trace levels for the alcohol use indicator?
Trace levels. Let me pull up the data dictionary. I think it's 0.08. All right. Okay, so if lab results indicate a blood alcohol value less than 10 milligrams or deciliters, or a result too low to specify a value, enter 0. Does that answer your question? Let me know if you have any other questions on that, and I'll send out the, Veronica, go ahead. You're muted if you're talking.
Okay. I had a question on your screenshot that you had. I missed it. And on the alcohol use indicator, when they were screened, and we use confirmed by test. So when exactly will we use confirmed by trace levels?
Confirmed by trace levels. Let me pull it up. So if it's less than 10, then it would just be counted as 0. So it would be confirmed
Right.
none.
So it'd be confirmed by test.
Yeah. Does that make sense?
Yeah, but I'm just curious. I'm wondering because there's the confirmed by trace levels in there, and I'm just wondering when we would use that.
Let me see if that may be a pick list option that needs to be turned off.
I thought I seen it on your screenshot earlier.
Let's see. Confirmed by test. Yes, so this may have been before I went in and changed all of the pick list options that needed to be updated, because confirmed by traced is not, well, it's under the legal, that's, hey, let me share the data dictionary. This will be more helpful to see that. Okay. Confirmed by test under the legal limits, NTDB trace level. So this is what that's referring to.
Okay.
But for
Okay.
ours, it says, let's see, per entity's trace level is defined. Any less than 10, and then put no confirmed by test.
Okay. All right. I got it. Thank you.
Yes. All right. All right, we did that. Okay. Reports. Oh, I also wanted to point out this, the little green box down here was a report that we had Runway build. It's encounters by day of week. And so everyone should have it. And if you want it and you don't have it, let me know. But it just breaks down your trauma volume by weekday. So it's just something that I think would be helpful to have. So I think that is all I have. I did get CE credit for this, so I will send out that form, and you send it into this email right here. So, but I also will point out, if you, this email is if you have your CSTR certification, or if you want credit for, if you're an ACS verified facility and you want credit because they make sure you're getting your CEs and that kind of thing. So you don't need to send it to me because I'm not giving you any credit, if that makes sense. It's really the ATS that is giving credit for this meeting. So I also wanted to make sure everyone knows I am actually pregnant and due in October. So if I don't know if we're gonna have, thank you. I don't know if we're gonna have TRUG or not. So we're gonna plan on it. And then if we don't, I will keep you posted. Thank you. Yeah. I'm not due until Halloween, so I'm hoping that we can still have TRUG. But I'll keep everyone updated. But if I just randomly cancel it, that's why we're not having it. But I'll also be out for a few weeks after that, but I'll definitely have a contact for you here, so that you guys aren't just left to your own. So thank you. Yeah. Anyways, I think that was all. And if anyone has any questions, feel free to email me. Thank you. Yeah, we're excited. And then, yeah, go ahead, Beth.
Okay, one more question. Sorry, I'm working from home and my next door neighbor is barking like their dog's barking like crazy.
Totally good.
I don't know if anybody else is having this issue because we're not a pediatric quote unquote center. ESO on our charts, ESO can't calculate the PEDS probability of survival scores on our pediatric patients, and they're saying that they can't fix it. Is anybody else having that issue?
I'm assuming you already have a ticket in for that then? Would you mind forwarding? Go ahead.
Yeah, we'll do that. But yeah, because that was one of the things that we noticed, that because we're not a quote unquote PEDS trauma center, it wasn't calculating. And
But
when we sent it,
you have all the same data as a PEDS trauma center, right? So why would it not calculate?
yeah, so
Okay.
I don't know. And they said it can't be fixed.
Okay, can you forward me that email string and then we can try to figure out why they're saying that? Because sometimes I feel like there's a different, they have a large support team, so you talk to one person and it's different than the next person. So I will talk to more of my contact instead of just someone on the support and see if we can get that figured out.
Thank you.
Okay, thanks. All right. Any other questions? Okay, thanks all. I appreciate your patience, and yeah, that's all I have for you. Have a good rest of your day. Thank you.